Macarthur.
Thank you very much, Mr Deputy Speaker. Before I start my prepared speech, I'd just like to say a few things about the efforts of the member for Goldstein with depends where you come from, but with respect, and I'm well aware of Rita Goldstein and her reputation. She's a wonderful woman. With respect to the member, the issue of vaporised nicotine substitution for smoking is certainly not as clear as he would say. There is absolutely no evidence that vaporised nicotine solutions, number one, reduce the harm, and number two, reduce the cost and the social cost of nicotine addiction. It's important to note that the tobacco industry continues to promote the use of the so-called vaping solutions as an alternative to smoking, with absolutely no research into its long-term effects. We know that nicotine is a highly addictive drug. We really don't have the evidence and the research that suggests that vaporised solutions are any solution to cigarette smoking in terms of long-term effects. And we've recently had a parliamentary House of Representatives inquiry into this, and all the experts, including the AMA, the College of Physicians, the Association of Respiratory Physicians, the Public Health Association, all say that we should not be allowing free access to vaporised nicotine solutions. So, as in many things to do with science, it's important that the government really respects the experts and acts on their advice, and the member for Goldstein is not doing that. And I'm unsure as to his motives for his broad and lack of restraint to support for vaporised nicotine solutions. Worldwide, there are about 1.2 billion smokers. I was one of them until about 10 years ago. 80% of smokers are men, and there are indeed smokers in this chamber. According to the World Health Organization, smoking accounts for around 6 million, that's 6 million, avoidable deaths every year. About 70% of those deaths are in developing countries. In Australia, there's still about 19 or 20,000 people who die every year from avoidable deaths due to smoking. The cost to our community is around $30 billion. And the annual cost worldwide is in the trillions. It's important to note that worldwide the major tobacco companies are still promoting their products, and it's only when their products are restricted do they resort to promoting other alternatives like vaporised nicotine solutions. Smoking rates throughout much of the OECD are continuing to decline, but rates of smoking in less developed countries are as high as ever, and there is some evidence in some countries they may be increasing. In most developed countries like Australia, rates of smoking amongst men are in decline, and amongst women they are flat or falling slowly. From the early 1980s, Australia has progressively tightened laws covering the advertising, sale and distribution of cigarettes and tobacco. There have been numerous anti-smoking health campaigns, and government assistance to those wanting to quit for life has increased, and excise duties have been substantially increased. I'm proud to be a member of the Labor Party that has promoted cessation of smoking activities and support for people to try and stop smoking, and laws have been enacted to prohibit smoking in the workplace and in public places, mostly promoted by the Labor Party. Each of those reforms was resisted by vested interests, but each now seems a sensible and totally uncontentious proposition. And it's the same for laws requiring the plain or standardised packaging of cigarettes, and I support any bill that strengthens this. The unambiguously good news is smoking rates are in decline across the board. Less encouraging is the more limited impact on some demographics, and principally older established smokers and those living in the poorest neighbourhoods and in regional and remote Australia. Indigenous Australians also have fairly static smoking rates, and unfortunately are at increased risk of the harm that smoking causes. Those with mental health issues also have smoking rates that are very static. 57% of daily smokers are now aged over 40. 15 years ago, the majority of smokers were between 14 and 39. 50 years ago, about 2 in every 5 adults were smokers. Now it's 1 in 8. The National Drug Strategy Household Survey showed that smoking rates halved between 1991 and 2016, from 24% to 12%, mostly because of government initiatives. There's been significant success in the last 3 to 5 years in reducing the take-up of smoking amongst the young, and the proportion of teenagers who were current smokers declined from 5% in 2013 to 2.1% in 2016. There have been similar significant declines in the number of people exposed in the home to cigarette smoke, down from about 31% in 1995 to 3.7% in 2013, and down again to 2.8% in 2016. These are significant changes, and whilst our smoking rates have only slowly declined, people exposed to smoking in the workplace and in the home have decreased significantly, which will lead to much less risk of harm, and in particular for my patients, children, and particularly very young children, they are much less frequently exposed to environmental cigarette smoking than previously, and this will lead to much lower rates of respiratory illness and much less long-term harm. The message in all these policies and for policymakers and legislators is that change is possible, that governments have to lead, and they must persist, against very strong, very financially able vested interest. Australia was the first country to enact laws to insist on the plain packaging of cigarettes. I remember this time very well, and it's important to note the courage and the persistence and the intelligence of people like Julia Gillard and Nicola Roxon, the Health Minister, who first introduced plain tobacco packaging. There was so much effort put in by those vested interests against the Labor Party's policies for plain packaging, including from those on the other side. And yet, Nicola Roxon and Julia Gillard persisted and were able to get these changes, which now seem to all of us completely sensible and the right thing to do. In November 2011, the legislation was first introduced, and by December 2012, the laws had survived a High Court challenge by those vested interests, including Big Tobacco. And by the 1st of December 2012, plain packaging was introduced and has stayed the norm in Australia. This legislation will strengthen the ability to monitor this, and years later it is really impossible to imagine why it took us so long to get there. Now, the previous speaker mentioned underground smoking as a consequence of the plain tobacco packaging. There is no evidence for this whatsoever. It's a claim without basis and without evidence. There may well be underground tobacco available, but this is a financial issue and has no relation to plain tobacco packaging. Australia's lead on mandatory plain and standardised packaging is now being emulated and followed to varying degrees in many other countries, including the United Kingdom, France, New Zealand, Norway, Hungary and Ireland. As is usual, it's Big Tobacco who's fighting this battle, and we can only hope that they continue to lose. As of February this year, another 16 countries plan to take action on plain tobacco packaging. The European Union has issued a directive allowing member states the option of implementing plain packaging that survived a concerted legal challenge from Big Tobacco. I imagine that the only people left in Australia opposed to plain packaging are those with a financial stake in the tobacco industry, or, I'm ashamed to say, politicians who take money from Big Tobacco. Nicotine addiction is not a matter of choice. I like to think that even a majority of those pathologically opposed to any form of government regulation or intervention recognise that nicotine is a special case. It's a drug of addiction and one of the most potent. There are only 2 commonly available legal or illegal drugs that are more addictive than nicotine, and that's heroin and cocaine. Nicotine is a poison, and there's no such thing as a safe cigarette. Cigarettes, of course, come with other dangers from the smoke inhalation, but it's important to note that nicotine is primarily a drug of addiction and not without major side effects. One cigarette, unfortunately, can be enough to kill you. It kills indiscriminately and it kills even those who don't smoke, and we've seen increasing evidence of this, particularly in the workplace. There's no such thing as safe smoking in the way that there can be perhaps low levels of safe drinking if done in moderation and in a safe environment. The same is not true for smoking. Nor is there much weight in the argument still advanced by some ultra-libertarians that smoking is legal, therefore we should not try to control or restrict it. Lots of things are legal that we don't encourage or want to condone. Many activities, products, services and substances are regulated. There is nothing odd or peculiar in regulating things that may be misused, poorly understood or which are inherently dangerous, and there's no question that cigarette smoking is inherently dangerous. It's just common sense that some goods and services are subject to advertising controls and point-of-sale restrictions. There are lots of legal drugs less lethal than nicotine that we rightly do not let people access at will or use without a doctor's prescription or without accompanying health warnings. Smoking only continues to be legal because it's well nigh impossible to prohibit its use outright, while millions of Australians can't give it up, even though as many as 3 in 10 every year try to. If this bill, one that makes very minor administrative changes to the law enacted by the Gillard government in 2011, is significant, it's because it marks something of a new dawn for the coalition. At long last, the coalition, while in office, seems unambiguously to be saying that it is not for turning in the fight to rid our country of its leading cause of preventable death and disease. And indeed, I do congratulate the Health Minister, particularly for his comments about the use of nicotine solutions. What would make this an even better day would be that the Nationals and other smaller political parties join Labor, the Greens and the Liberals in refusing to accept donations from big tobacco. The Hawke government enacted laws in the 1980s to provide public funding for election campaigns to reduce the influence of private and corporate donors. That funding is not just a taxpayer-funded freebie, it's there to allow all parties and all candidates to exercise a freer hand in accepting and rejecting political donations. Labor stopped taking blood money from the tobacco industry 14 years ago. The Liberals followed 10 years after that. Thank God. However, the Nationals and Senator Leyenhelm's Liberal Democrats have in the last 5 years continued to accept direct donations in the tens of thousands of dollars annually from one tobacco company, Philip Morris. More shame to them. The level of indirect support they've taken is, of course, unknown. In accepting such donations, the Nationals and the Liberal Democrats are the most conspicuous of the remaining outliers, steadfastly opposed to community sentiment and the now mountains of evidence and analysis on the effects of tobacco. Small in number, but there are still probably enough of them to apply the handbrake to further and much-needed work in reducing the incidence of smoking. And indeed, there are still measures that we should be enacting that will help reduce cigarette smoking rates in Australia, and we should also be cognisant of the effect of smoking in the developing world and our near neighbours, and we should not hold back from support for reducing smoking rates in those countries. As we all know, with this government, it's the minority that sets the rules, unfortunately, while the rest only ever seem to assert their authority ineffectively or when it's too late. Just ask Malcolm Turnbull. That wasn't always the case. Not all governments are afraid of their own shadow. The reforms to cigarette packaging proposed by the Rudd opposition and enacted by the Gillard government and its Health Minister, Nicola Roxon, were transiently opposed at the time for all sorts of spurious and self-serving reasons. True to form, some in the Liberal and National parties, the usual suspects, either wanted to duck the issue or play both sides of the fence. Others just wanted to make life difficult for those supporting plain packaging because they saw political advantage in it. Yes, the Abbott opposition finally went along Labor's plain packaging law, but only after some principled members of the coalition threatened to cross the floor to support it. The public was warned that mandatory plain packaging was unconstitutional. What a silly reason to bring up. It clearly wasn't, and the High Court supported that. They were told that the scheme was costly and impractical. Wrong again. There are even claims from the tobacco industry that plain packaging would lead to increased levels of smoking. What a joke, quite silly, and all archly and narrowly political to the nth degree. I support this bill. I'm proud, as I've said, to be a member of the Labor Party that has done all it can to reduce smoking rates in Australia and elsewhere. I commend the bill. Thank you.
I thank the member for Macarthur.